Hello friends, how are you all? Today we'll discuss a very important topic. We'll learn about the various causes of high blood pressure. Let's quickly get started. Before the video begins, firstly, let's consider age. As we age, the risk of high blood pressure increases. Our home's water pipes, if new, remain soft, but harden and get clogged as they age, increasing the internal pressure. Similarly, as we age, the blood vessels or blood pipes in our body become stiff and narrow and accumulate plaque, which can lead to increased blood pressure. Gender, whether you are male or female, women generally have estrogen, which helps keep blood pressure low. So high blood pressure is more commonly seen in men up to about age 64. However, as women age and their estrogen levels decrease, from age 65, the likelihood of women having higher blood pressure increases compared to men. Next, let's talk about ethnic influences. People of African descent tend to have higher blood pressure, and it appears at a younger age compared to white populations. I would also say that South Asians, people from India, Bangladesh, Pakistan, and Sri Lanka, have a higher probability of developing high blood pressure compared to people from other countries. Family history is also a major factor. If someone in your family suffers from high blood pressure, you are more likely to have the same issue. Another cause is the excessive use of salt or sodium, which often hides in packaged foods and is also added during cooking or eaten with meals. If the body has an excess of salt or sodium, it retains water, which can increase blood pressure. Similarly, if there is a lack of potassium in our body, like the green vegetables and fruits rich in potassium that if we don't eat enough, our body will have low potassium levels. If there's too much sodium and too little potassium, the balance or harmony between sodium and potassium is disrupted, which can lead to increased blood pressure. Potassium in the right amount is also vital for maintaining a healthy heart. There are some diseases and medications that can raise our blood pressure without us knowing. Due to these conditions, our blood pressure can rise. And I will discuss in detail in my next video which diseases can unknowingly increase our pressure. Just know today that diabetes or thyroid issues, or kidney problems where the kidney fails, sleep apnea, or issues with thyroid hormones where our thyroid sometimes works less or more, can cause unnoticed high blood pressure. Pregnancy. Sometimes high blood pressure can occur during pregnancy, a condition called preeclampsia or eclampsia. Medications such as cyclosporine, cocaine and other drugs, oral contraceptives used to prevent pregnancy, corticosteroids, which are used for various problems, or anabolic steroids used by bodybuilders, erythropoietin, leflunomide, present in some herbal medicines, non-steroidal anti-inflammatory drugs for pain, venlafaxine used to treat depression, decongestants containing ephedrine, and herbal medicines containing licorice or ginseng. Now, coming to the next cause, I have mentioned in previous videos how chronic and excessive alcohol consumption can increase weight and stop blood pressure medications from working properly. The relationship between alcohol consumption and high blood pressure is particularly strong among men. Mental stress. High mental stress can temporarily increase blood pressure. When stressed, people often eat more, which increases weight. Smoke tobacco or drink alcohol, which further increases blood pressure. Obesity or being overweight also increases the risk of high blood pressure. Excess weight causes changes in the blood vessels and affects the functioning of other organs. Lack of exercise is another reason. Without regular exercise, weight continues to increase, which raises the risk of high blood pressure. The use of tobacco products or vaping, smoking, chewing tobacco, or vaping temporarily raises blood pressure. It damages the walls of the blood vessels and accelerates the hardening of the arteries. These are the reasons for high blood pressure. If we become aware of these factors and take appropriate actions, we can keep our health much better.